I just think that it's just impressive how far the public mental health system has come since the early 1960s.
Well, the Community Mental Health Act of 1963 is what created all of the community mental healths.
We provide services to children and adults, children who have a diagnosis of a severe emotional disturbance, children with an intellectual or developmental disability, and children with substance use disorder. We also provide services to adults with intellectual or developmental disabilities, adults with mental illness, severe mental illness, and or substance use disorders.
I was born with cerebral palsy, and I am CMH's first peer mentor.
A couple summers ago, they gave me a peer support specialist. So her job is to support me and advocate for my needs and what I need.
One of the facts I think is important for people to hear is that 1 in 5 Americans will experience a mental health episode or be impacted by a mental health issue at some point in their lives.
So that if somebody is sitting at home and has somebody in their family who they think is in danger, who's at risk, they can pick up that phone.
It's important for people to remember that people don't wake up one day and say, I want to be an addict or I want to be an alcoholic. It's a disease, just like they don't ask for a mental illness.
Coming from a place where I was in addiction and being the lowest place of my life, and to be on the other side of that, I can really relate to what some of the people that are here are going through, and to let them know that there is a way out.
Our focus is on the entire person. We trained our whole workforce in integrated healthcare and what that means. So with our partners, Lake Huron Medical Center and our local St. Clair County Health Department, we have served over 900 individuals, because we know that if you have a serious mental health issue, it can affect your physical health. And you don't just treat the head, you don't just treat the bottom half. You need to treat the whole person.
After that it becomes, how do we teach people not to get back into it, and how do we enhance their lives as they move forward, and believe that everybody can recover from whatever bump in the road they just hit.
So recovery is possible. It's not only possible, it's to be expected. There's several pathways to recovery: choice, hope, spirituality, empowerment, and environment. For me, I think hope is the most important one, because if you feel hopeless, somebody has to hold the hope for you. Our staff they're key in that, and if they were not optimistic, didn't hold the hope for people when people can't hold it for themselves, we wouldn't have the success that we have.